morning, Dr. Jayashree Thodkar here. In the series of discussion about obesity and its impact on the health, today we are going to talk about the mechanical impact of obesity on the health, particularly the skeletal system. Our skeleton is made up of skull, spine, and the legs, extremities. The complete skeleton can be divided into three types: a small frame, medium frame, and a large frame. Particularly, when we are talking about the frames, we should know that the body mass index, which talks about the ideal weight of an individual, takes into consideration the height and the frame of the individual. That is where between 18 to 25 is the body mass index called as normal. Above the BMI of 25, the weight becomes more for the skeletal system to handle, and after the BMI of 28.5, the obesity starts, which can be abnormal for the body to handle. When we talk about obesity and its impact on the bones and the joints, first thing that comes up to us is the knee pains. But knee is not the only joint which can get troubled. The foot, all the bones in the foot, ankle joint, knee joints, hip joints, the spine, the pelvis, including the spine of the neck, everything gets affected because of obesity. Obesity, particularly in Indian setups, is seen as the central obesity or the big tummy. As the tummy starts growing, or overall weight on the skeleton start growing after the BMI of 28, typically the complete alignment changes and there are drags because of the gravity on the complete skeletal system. Plantar fasciitis, foot pains, the ankle pains, gout, arthritis-like situations, the knee which goes into a very sudden wear and tear or with very small accidents or very small injuries, the hips which can start going into an abnormal alignment, even the legs can go into bowing, the spine which changes the curvature. All these things start impacting your complete skeletal system with the growing obesity. The other part of the body is the varicose veins, which can be seen prominently when the patient crosses the body mass index of 35. All the veins of your legs drain into the heart. It is an anti-gravity mechanism which is supported by good number of valves. With the growing obesity, the valves start defunctioning or going into a ruptured kind of manner where they cannot hold on with this kind of blood columns against the gravity, and this is how the varicose veins start coming up. These are all the impacts of obesity on your complete joints and the bone health, as well as the venous system of the leg. Very particularly, gout is very commonly seen in obese patients because the inflammation comes very easily in the obese body, which is bad with the chemicals now. The second part which is common with these patients is a frozen shoulder. Please remember, if there is no particular history of injury to the shoulder and you are getting frozen shoulder with very trivial injuries or trivial trauma, then remember you may be having diabetes, which is underdiagnosed and undertreated in the obese patients. cervical spondylosis, lumbar spondylosis, the sciatica kind of pains, plantar arthritis, osteoarthritis of the knee and the hip, varicose veins, venous stasis disease of the leg, gout. These are all various kinds of representations that your bone and joint health is not good and is not able to support your weight. Many patients ask us whether we should go ahead with the joint replacement surgery first, followed by obesity treatments. The answer is, has the obesity given you bad joints or have the bad joints given you obesity? The answer is simple. If obesity has come first and then the bad joints, then please go ahead with the obesity treatments first so that your new joints can stay long as far as your life is there with a better health and with a better function. Stay tuned. In the next discussion, we are going to talk about the adolescents and their problems because of obesity.